great. You can be seated. Class of 2024, faculty, staff, friends, and family, good morning. It's my great pleasure to welcome you to the Physician Assistant Program's Induction Ceremony. My name is Kathy Ruff. I am the Program Director for RVU's PA program. As you will hear today, the significance of the white coat is its recognized symbol of healthcare practitioners. The ceremony itself represents one's journey and growth into becoming an informed, professional, and compassionate provider. We are honored to be part of this journey and pleased that friends and family are joining us to witness this auspicious event. Today you will hear from several speakers, including a member of university leadership, our invited speaker, and one of the PA program's medical directors. We'll then introduce the class of 2024, who will be presented with their white coats. And that will be followed by a very few brief closing remarks. And now, without further ado, I invite Dr. Ed Bilski, Provost and Chief Academic Officer of Rocky Vista University, to deliver a welcome.
Thank you, Kathy, and welcome. I do have scripts so I don't screw things up, but I do want to, again, this is a heartfelt address to the PA students who I've had the fortune to teach. So welcome, everybody. This is really is a privilege for me to represent the RVU leadership. I am joined by President Borstein here. He's going to help celebrate your successes in the transition to the clinical rotations. For me, the PA profession and being a medical educator started early in my career. I was in 2001 an assistant professor at the University of New England, and the PAs were the first cohort that I taught. Over the ensuing decades, I have taught hundreds of physician assistants, and I was really given an opportunity and another privilege by the director and the faculty to teach this cohort in the spring on opioids and opioid pharmacology. And I must say, this is the first class that has ever had me come up in front of them and take a selfie with them. And I just learned today that from one of your classmates that one of my more memorable things that will never, ever leave their brain is my example of using potato chips to talk about the endogenous opioid system. And when I go on autopilot, when I put them in the front seat of the car on the way home from the grocery store. So I have made an impression on your sons and daughters. So your intellect, your professionalism, and your commitment to your education are readily apparent. And I've seen that firsthand. I also really appreciated that warm welcome that you gave me and extended also to my daughter, who was a pre-PA back east. She toured RVU's program, and the PAs were very accommodating and welcoming. So thank you guys for that too. So the RVU curriculum has certainly provided you the foundation for sciences and clinical skills needed for the next phase of your journey. Equally important, it has fostered already your innate compassion for those who are going to be under your care. You truly are compassionate human beings, and our communities are going to be better off because of that. So we congratulate you on this next step of becoming a physician assistant, and look forward to seeing you walk across that stage in the not-so-distant future. Congratulations.
I like to hide a little bit instead of standing right in front, so I'll stay here. All right. Our invited speaker is Mariah Reneker. I am proud to share that Mariah is a graduate of the Rocky Vista PA program and a member of our inaugural cohort, the class of 2020. Mariah received a bachelor's degree in kinesiology and health promotion from the University of Wyoming and a master's degree in clinical exercise physiology from the University of Wisconsin, La Crosse. She worked in cardiopulmonary rehab and public health before her acceptance into PA school. As a part of her training here at RVU, Mariah completed longitudinal clinical rotations, spending nearly an entire year in the small town of Show, Arizona, with the goal of ultimately returning to her rural roots. She was a member of the program's first student leadership group, serving as a class president and representative to RVU's Student Government Association. Not only did she represent the program with professionalism and grace, her consistently positive nature and genuine compassion reinforced an inclusive, supportive, team-oriented environment for the entire cohort. As a result of her great efforts, she received the program's Collaboration Award for the outstanding contributions she made to the class and to the program through her leadership, her character, and her service endeavors. Upon graduation, Mariah returned to her home state of Montana, where she first worked in inpatient cardiology before transitioning to family medicine. She provides a full range of primary care services within the Bitterroot Health System located in her hometown of Darby, Montana. And I think she's going to tell you a little bit more about her hometown in a minute. Mariah's approach to healthcare is patient-centered, emphasizing lifestyle modifications to improve health outcomes for patients of all ages. As an indication of how much she is valued by her small community, she was nominated as Bitterroot's Best Physician in 2023. Outside of work, Mariah can be found enjoying the many outdoor activities Darby has to offer, hiking, biking, skiing, and fishing, and spending time with her husband and their border collie. Mariah could not be a better representative of RVU, and it is my honor and privilege to call her a colleague. Please join me in welcoming Mariah Reneker. I'm going to hide over here as well, just so I can flip my pages. Thank you, Kathy, for that great introduction. And I want to thank the class of 2024 for allowing me to be here today on this momentous occasion. I can't believe it's been 4 years since I sat in your seat in anticipation of donning my own white coat before I was transitioning into my clinical rotations in Shiloh, Arizona. At the time, I had no idea how impactful those months were going to be for me. And the transition to clinical rotation amplifies your commitment to service, and it highlights what your career will potentially look like. I'm honored to be here not just to help inspire and light a spark for you guys, but also here in gratitude to RVU. When I came and interviewed at Rocky Vista, they were recruiting students who could help pave the way. I'm happy to say that RVU really has helped me pave my path to becoming a physician assistant and in my current career. When Kathy asked me to speak, I was very humbled. Obviously, as a student, I had showed several qualities that they had remembered and wanted me to come represent. But I asked myself, what have I done as a PA to confirm those thoughts? So I thought back to the Ron Taylor Memorial Scholarship. Had that been presented this year? So Ron Taylor, he was a pioneer for family medicine physician assistants. He sat on the RVU steering committee. He embodied the mission of the RVU PA program to create competent, collaborate, and compassionate family practice physicians who would practice in rural areas. I was awarded this scholarship right before I started my clinical rotations. So in preparing for today, I looked back at my application to that scholarship and things that I promised I would do to see if I actually had met those expectations. So a couple of things I wrote in that essay. As a primary care PA, I will help integrate public health initiatives into the clinic. That was 1 year before COVID-19, just saying. I made the statement, I would directly provide guidance for behavior change and help my community thrive because I would be a member of that community. I planned to work in a rural town after graduation, and I wanted to be a member of that community involved in the schools. As a primary care PA, I will make it my duty to know the community resources that are available and help my patients navigate and access those resources. I had honestly forgotten a lot of what I wrote in that essay, but as I read it back, I smiled to myself. Because in the last 2 years of my clinical practice, I think I've done a pretty good job holding to Ron Taylor's memory. My path to becoming a PA was shook by COVID-19. Probably most of you in here were affected. But ultimately, it was the disruption of that that helped me get to where I am today. I left my longitudinal rotation in Sholo, Arizona. I returned to my hometown. And when we were given the word, I reached out to finish my clinical rotations close to home. I completed an emergency medicine rotation at Vista Health Hospital, where I was born. And then I did a second cardiology rotation at Community Medical Center in Missoula, Montana. Both of which were on a hiring freeze, but I submitted a resume anyways. I was offered a job in inpatient cardiology right out of PA school. Cardiology is something that has come second nature to me, so it was an easy transition. But ultimately, I knew it's not where I wanted to go. I started this journey to be a family practice PA. So for 8 months, I drove 70 miles one way, 5 days a week, and worked inpatient cardiology. I dived into coronary artery disease, heart failure, and the world of arrhythmias that I'll never understand. And then I actually got a phone call from Vista Health asking if I'd like to come interview for a primary care job in Hamilton, Montana, which was about 25 miles away from my hometown. And they had called me based off of the recommendation of the emergency room provider I worked with and a year-old resume. So I left my cardiology job. I went and worked in primary care. And after about 6 months, my organization said, the nurse practitioner in your hometown in your small clinic is going to be leaving. Do you want that job? And I hesitated. Was I ready for the autonomy that this position would force me to have? Was I ready to handle the provider-patient relationships that are very complicated, managing patients in your hometown? How would I deal with complicated patients without having a supervising physician on site? And ultimately, I decided I needed to take this opportunity because I was in a unique position to empathize with this patient population, and I would use the tools that I learned in my clinical rotations in order to help these patients. So currently, I am the only provider in Vista Health Clinic South, Darby, Montana, population 825, home of the Yellowstone TV show. I work for a rural health clinic. So to get that designation, you have to be associated with a critical access hospital, which is about 25 minutes away. And due to the growth in our community, I'm currently sitting on a steering committee and a planning committee for a new clinic that will have 3 times the capacity we currently do. And I am welcoming a MD partner who will join me in August. So I'll finally have somebody to talk to daily. And I kept my promise to Ron Taylor. I work with the school. I do sports physicals for them in the summertime. I help them write 504 plans. And I currently just taught my first reproductive health to 7th and 8th graders. Great awkward time in their life. So just 4 years after sitting where you are sitting, I am making promises and continuing Ron Taylor's legacy. I manage complex patients, newborn babies, and mental health crises. I have about 1,300 patients, and about 50% of them are over the age of 65 with complex medical conditions. I'm empowered to do this not only from the didactic experience that RVU provided me, but my clinical rotations. Reflecting on their clinical rotations, each of my preceptors and rotation sites were equally valuable in preparing me. General vascular orthopedic medicine helps me with knowing what pre-op is needed, what complications are associated, and what post-op things patients can expect, to sit down, help educate them,
as they're making choices about their condition. Hospital, internal, and family medicine help me every single day, and I frequently flip back to the notes that I wrote during those rotations and see how my preceptors would manage these patients. Pediatrics and OB-GYN are probably more valuable to me as a rural health provider. The closest pediatrician is 70 miles away. So I commonly do postpartum care for women and newborn baby care. So without that, I would be scared out of my pants. I'd rather have complex sick patients than perfectly healthy newborn babies, for sure. And last, the behavioral health rotation. I probably use this the most. On a day-to-day basis, I would say 50% of my patients have positive GAD-7s and PHQ-9. Our organization actually went to implementing every patient every time has a PHQ and a GAD, just because it's so prevalent. Like every community in a rural health, mental health providers are lacking. So knowing how to manage a patient in crises, really learning how to collaborate with people in your community, and how to hand off those patients is really, really important. So I hope each of you have goals and dreams about what your future looks like as a PA. And I hope that you understand clinical rotations will help you get there. Today, I task each of you with staying longer, digging deeper, and asking more questions. This is the time to gain knowledge, and this is the time to make mistakes. You will all be guided by carefully vetted preceptors, and they are going to help you build these skills. But you have to be seeking the opportunity to learn. During your clinical rotations, there is absolutely no time for ego. You have to set that aside. If you think you know the answer, give it. But do not be afraid of the critical feedback that's going to come your way when you answer that wrong. This is a learning opportunity, and it's going to help you manage your first job and manage your patients. I challenge you to stay even when the preceptor says you can go home, especially on your OB rotations. I had the pleasure of catching and delivering over 30 babies in just 1 month, and only 10 of those were during clinic hours. So if you want to do it, you got to stay. It's going to be your opportunity to practice integrating guidelines and recommendations. Medicine is a continuum of learning opportunities. And guidelines and recommendations are forever changing. They've changed since I was here when I first started. And sometimes you're going to be more informed. You're going to be more informed than your preceptor, than your supervising physician, and your peers. But how you handle that and how you talk about that is going to set a precedent of what type of provider you're going to be. So my role, what I see it as a primary care physician assistant, and this is my tagline to patients, other than what is a physician assistant. My role is to inform patients of the best practice, evidence-based medicine recommendations, and be their partner in helping them make healthcare decisions, empowering them to make the choice that best fits their lifestyle once they can demonstrate understanding of that. As you can imagine, in rural Darby, Montana, most patients aren't compliant, so you have to learn to be very flexible and knowing that what you learn, patients are not always going to accept. But if you can educate them and make sure they're making an informed decision, you're doing your job. I'd like to finish with a patient case that when I think back to, I think it really defines who I am and who I want to be as a PA. So about 3 months into my cardiology job, I had the opportunity to advocate and educate a patient when it mattered the most. This patient had been experiencing accelerating chest pain for about 2 months. By the time he presented, he had a 99% blockage of his left main. It was recommended that he be emergently transported to a different facility that could perform CABG. and he thought about it for about a minute and refused transfer. Up until this point, this patient was very healthy, and his medication list included a leave for aches and pains. After he had several friends undergo CABG, and he really understood what it meant to go through the surgery, and he understood what it meant to try and recover from the surgery. And his position was that he would rather die at home in his garden. So for the next 2 days, as we were stabilizing this patient, I spent the time and really sat down and talked with him. I got to know him and his wife. We talked about his past experiences, his kids, and the things that he had gotten to do with his life. And it was clear to me that he understood the consequences of his actions and that he would be looking at certain death without proceeding with CABG. My attending physician, who is an interventional cardiologist, does anybody have a friend who's a cardiologist? They have an ego the size of Texas. He was not satisfied with this patient's choice to not proceed with surgery, and he made that known to the patient and his wife. I, on the other hand, chose to support the patient. I gave him a big hug when he was leaving the hospital, and I answered his wife's phone calls for the next 2 days about dosing of nitro and trying to limit his pain. About 2 weeks later, I got a thank you card in the mail. It was very sincere, and it was a deep gratitude from his wife that I supported, and I loved this patient, and I let him make this choice, knowing what the outcome was going to be. And ultimately, my support helped her cope with him making that decision to not be there anymore with her, and it helped her transition through his death. And that it stuck with me. I had never gotten a thank you note for essentially letting somebody pass. But it reminded me that having compassion and listening to your patients and really hearing what their goals are is the root of my job and doing my job well. So as you don your white coat today, I hope you make it a priority to truly be competent and collaborative, but most importantly, be a compassionate PA. Thank you.
Thank you, Mariah. Dr. Joey Stasio serves as chair of the primary care department for the College of Osteopathic Medicine. He has been providing primary care services as a DO for nearly 30 years. Fun fact about Dr. Stasio, he's also practiced as a family medicine physician assistant for 7 years before pursuing his DO degree. In addition to his duties in the College of Osteopathic Medicine, the PA program is truly fortunate that he has served as our medical director of the didactic curriculum since the beginning of the program. In his spare time, you can find him on the golf course, restoring Mustangs, and I'm talking about cars, not rural horses. He plays guitar, and he flies to the friendly skies because he holds a pilot's license. Please welcome Dr. Stasio.
Thank you very much, Kathy. I'm honored. And Mariah, that was fantastic. It's so good to see you again as the inaugural class. So I'm going to spend a few moments talking about the significance of the white coat. So I'd like to, again, welcome the class of 2024, faculty, friends, family, and significant others. So let me share a brief history and the significance of the white coat and its place in medicine. I suspect for some of you, your earliest memories of visiting the doctor focused on the white coat. Sometimes the white coat was reassuring and comforting, and perhaps for others frightening, especially if you were children and seeing the pediatrician. So how did the white coat become a symbol of medicine? The significance of the white coat parallels in many ways the development of medicine as a craft based on scientific thought and reason rather than folk remedies. Looking back to the 1800s, there was very little known about the scientific practice of medicine. The instruments consisted of various saws and other tools for amputation, speaking to the art of medicine in the 1800s. Of note, during the 1800s, the color for physicians was black to hide the bloodstains. Additionally, visits to the physician often were done as a last resort, and death was frequently at hand. So, on the other hand, the scientists of the day tended to wear white coats for doing their research, which frequently revealed the inadequacy of the medical practice of the day. During the 1800s, several significant events changed the face of medicine forever. So, Dr. Joseph Lister, and that's where the term Listerine came from Dr. Lister, demonstrated that aseptic techniques and practices dramatically improved the outcome of surgical procedures. His contributions began to move medicine from home remedies and quackery to the realm of bioscience. Shortly thereafter, in 1889, Dr. Aiken's masterpiece painting of the operating theater showed the patient draped in white sheets, the physician in a white smock, and the nurse wearing a white cap. In the same year, a photograph of the operating theater at the Massachusetts General Hospital showed physicians in white coats covering their street clothes. In 1892, Sir William Osler's textbook was published portraying medicine as a scientific endeavor. Then in 1910, the Flexner Report on Medical Education resulted in the closure of numerous questionable medical schools of medicine. And Dr. Walter Reed clearly established the role of mosquitoes in the transmission of yellow fever and the value of aseptic technique and cleanliness. By the beginning of the 20th century, medicine had become truly a scientific endeavor, and over the next 50 years, medical science advanced at an incredible rate with discoveries such as insulin, the development of antibiotics, and rapidly improving surgical techniques. Along with these developments, the white coat became firmly entrenched as a symbol of modern medicine. Today, the white coat ceremony is relatively a new ritual. The first full-fledged white coat ceremony took place at Columbia University College of Physicians and Surgeons in 1993. Grants from the Robert Wood Johnson Foundation helped advance the white coat ceremony far beyond Columbia University. In just a few years, nearly every medical and PA school in North America has adopted the ceremony. It's evident rituals can be created. A person's identity after receiving their white coat is altered in a variety of ways. They are now seen and expected to act as medical professionals. It is seen as a symbol of professionalism, humanism, and ensure that students commit to those virtues throughout their medical training and career. Students, as I welcome you to the art and practice of medicine with the white coat, I ask you to consider the seriousness of what you are about to undertake. It is unlike any other experience you will ever have, as you now become responsible for the care and well-being of those around you and those who seek your help in their time of need. Recognize the challenge, embrace the art and the practice of medicine, and the very best to all of you. Good luck.
Thank you, Dr. Stasio. We're now to the point, certainly, that everyone has been waiting for, the introduction of the class of 2024 and presentation of the white coats. Each member of the class will introduce themselves and join members of the faculty on stage, and the faculty will then coat each student. Students, you can come on down, and faculty as well.
Martin Aguilar.
Sydney Allen. Dylan Berman. Sarah Brenner. Allison Birch.
John Carey.
Luis Gabriel Chavez.
Sheridan Decker. Madison Emnett. Wendy Gray. Megan Gritza. Mira Habib. Emma Hess. Nicolette Holcomb. Andrea Holtgren. Haley Kagimoto. Kat Keller. Courtney Kraus. Ashley Mendoza. Alina Noor. Alina Noor. Megan Reale.
Robert Ringwall.
Ellery Roberts.
Aaron Ryan.
Tarek Sakori. Haley Segelke.
Alexandra Skender.
Samantha Smith.
Ashley Spellman.
Jenna Steins.
Tori Thorley. Kendra Vroman Verkindren. Grace Williams.
Can we get a round of applause for our class of 2024? To our students, on behalf of the Board of Trustees, administration, faculty, and staff at Rocky Vista University, we are proud of how each of you has grown over the past year, and we're looking forward to seeing how you continue to develop over the course of the next 15 months. Congratulations to the class as they transition into clinical training. At this time, I'd like to acknowledge and thank everyone who made this ceremony possible. I now declare this year's White Coat Ceremony officially concluded. Thank you for being part of celebrating the accomplishments of our class of 2024. We invite you to join us for some light refreshments on the second floor. Thank you.